The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Brain tumors can present with many different symptoms. Ultimately, it really depends on where the tumor is located and basically what it's doing. The tumors generally tend to cause problems, if they cause problems at all, by pushing in on the normal brain, which can either lead to symptoms from the brain being compressed, which can lead to symptoms such as headaches or nausea or vomiting, or it can actually, depending on where it's located, it can actually cause loss of function. This can manifest as symptoms such as stroke-like symptoms, which can include numbness, tingling, weakness, or difficulty speaking. Brain tumors are usually diagnosed by either a CAT scan of the brain or an MRI of the brain. Now, that said, that gives us an idea about the fact that we're dealing with a tumor and can sometimes give us enough information to determine whether or not it needs further treatment or evaluation, or whether it can just be watched. However, it doesn't tell us with certainty what type of tumor is being dealt with, and that ultimately requires getting a piece of that tissue for the pathologist to look at under a microscope. That generally involves either a needle biopsy or open surgery. How brain tumors are treated really largely depends on what we're dealing with. If the tumor looks like a benign tumor such as a meningioma, which is small and doesn't have particularly aggressive features, and also in some pituitary tumors as well as other more common benign tumors, many times they can just be observed with imaging, which can be, occur on say a yearly basis, for example. However, if a brain tumor seems to have more aggressive features, usually it requires a combination of surgery, especially if it looks like the tumor's in a location where it can be safely removed, followed by some combination of either chemotherapy, radiation, or sometimes what's called stereotactic radiosurgery, which is a recent development that allows us to give focused radiation to a tumor in an outpatient setting without disrupting any more of the normal surrounding brain tissue than is necessary. One of the great things about where we are right now is that with modern technology and advances in surgical technique, many brain tumors that would have been what would be considered a death sentence about 50 years ago are now very treatable, and many patients with brain tumors, in spite of having fairly aggressive brain tumors, can still live long, healthy, happy, productive lives.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.